African National AIDS Council has received a multi-billion rand windfall to help accelerate the end of the country's three known epidemics, HIV, AIDS, TB, and STIs. The funding will further support the National AIDS Council in bringing together government, civil society, and the private sector to create a collective response to the three diseases, with the ultimate goal being to eliminate them. Joining us now for their perspective on the $547 million grant is Treatment Action Campaign's General Secretary, Anele Yalwa. Anele, good evening and thank you very much for your time and joining us tonight here on In Focus. I mean, what we're hearing as far as the statement is concerned, and maybe you might have more details, is that the money will be used to fund government's AIDS and TB programs and will cover the period from April this year until March 2025. Is that good news? Do we know where this money is going to be channeled to, and is it going to be put to good use?
Evening to you, Thabo, and the viewers at home. Firstly, on behalf of TAC, we welcome this news from the Global Fund and from our government. But also, it must not be about money. It must be about the implementation of what is promised to the people of South Africa and how is the money going to be used. Thabo, we need all of us to understand that TB is one of the killer diseases in South Africa. It is estimated that about 167 people are dying of TB every day in South Africa. And it is against this reason, as TAC in 2021, we marched and we called for TB to be declared as a public health emergency. And then after that, we were able this year in March to meet with the Deputy President, the Minister of Health, the SANAC Civil Society, and other progressive forces to discuss as to say how best can South Africa respond to TB, HIV, and COVID-19 without leaving or prioritizing COVID-19 over HIV and TB. We have seen during the hard lockdown, many clinics, HIV and TB services were not provided because the priority was the COVID-19. Communal care workers who were deployed in clinics to provide HIV counseling and testing services were taken out of the clinics and deployed to our communities to track and trace people, conduct and also screen. And we asked our government, why are we not integrating HIV and TB services? Because we have seen that many people living with HIV and TB in that period were lost on follow-ups. So we said there are a lot of people who were on HIV and TB treatment who dropped from the program, but also we have seen as the country that there are many people who are not screened on TB, and then it is against that reason we said we need to declare TB as a public health emergency. We called upon our government to provide political leadership in order for us as the country to be able to integrate HIV, TB, and COVID-19 services. So now we engaged with our government. We have seen that there is a TB recovery plan which is going to be implemented from September, which seeks to address the challenges around TB services, and we have heard that the government is planning to implement this TB recovery plan in 12 districts in 7 provinces. However, our duty as activists and progressive forces on the ground, our duty is to monitor the implementation of this TB recovery plan, is to monitor how is this money going to be spent, because on a number of occasions, monies, huge budgets like this, they don't go on the ground to improve services at facility level. They go to consultants and other people who are not playing a pivotal role in terms of addressing the services on the ground.
Let's look at the TB recovery plan itself, Anele. I mean, is it valuable in and by itself? Have you had sight of it? Does it cover the necessary processes in as far as how it was developed, and was there input from your side and other stakeholders in how this recovery plan is going to be approached?
Yes, we made inputs on this TB recovery plan, but also, Thabo and the viewers at home, always you will see that we've got beautiful plans on paper, but when you go on the ground, on a number of occasions, these plans are not implemented adequately. So it is our duty as progressive forces, as TAC, as SANAC Civil Society, SANAC TB Task Team, PHIV sector, TB Thinking Tank, to go on the ground and monitor the implementation of that TB recovery plan, as well as look at what is promised to the people of South Africa, so that where we identify gaps, we can be able to continue to speak truth to power and hold those in authorities accountable if these promises are not implemented on the ground.
So ideally on the ground, for somebody who's got a hang on it and who's looking at it on the ground, what is needed? Share with us exactly. If you were to give them real concrete direction as to where they should be channeling this money, what is currently needed on the ground?
What is currently needed, Thabo, is for our government to hire more community healthcare workers, more healthcare workers, in order for our clinics to be able to have that capacity to provide quality services to our people. We have seen during COVID, even today, when we go to public institutions, you are being screened. But when we go to clinics, people are not screened for TB. So this is one of the things that we're calling upon. But also, we are calling for the implementation of the TB recovery plan to speak to the challenges of the people on the ground in terms of coming up with new diagnostics tools, with effective medicines to treat TB, and the number of interventions that we want to see on the ground is what was not happening, because we have seen during the COVID-19 that there was a huge number of community healthcare workers and healthcare workers who were hired to respond to TB, to COVID-19. But as from the end of March this year, all these healthcare workers and other health providers, their contracts were terminated. So we are saying, without adequate human resource, without foot soldiers in the form of the CHWs, without proper education and proper awareness around TB, without proper screening of TB, without adequate medicines for TB, we won't be able to address what we want to address on the ground. So there is a list of things that are promised on the TB recovery plan, and that's why at this present moment, as TAC, we are preparing TAC branches in these 12 districts, so that when the government is implementing the TB recovery plan, we know that TAC members, together with communities, are informed of what is contained on the TB recovery plan, and we reach out to communities to educate them about TB prevention and everything that is related to that. So when the government is implementing that, this plan, we know what is exactly that we are looking for, and we monitor the implementation based on what is on the plan.
Yeah. Given the current state of policy priorities, the kind of constraints that are currently there as far as movement throughout the globe, I suppose, because of COVID-19, do you think it is a realistic expectation that, for example, new technologies will be brought in as far as diagnostic tools are concerned, that effective medicines are going to be sought, or are these already readily available that government would need to just make the investment and these would be able to be made available to TB sufferers?
You know, Thabo, I don't want to behave or act like I'm a fortune teller. Firstly, let's believe what our government is saying, because there is money, and we believe that the government does have the capacity, because they have just appointed Dr. Njeka to be the TB lead in the country. So everything that they have promised the people of South Africa, we believe that they are going to do. And on top of that, we are going to go on the ground and monitor. So it is only when we see things that are not happening right, or when they are happening right, where we will be able to say, thumbs up to our government, you are doing well. But if things are not happening right, it will mean that we will continue to speak truth to power. But the good thing about it is that as TAC, we are no longer talking from outside the fence. We managed to demand a space around the discussion table. So we will always sit in these meetings, monitor the implementation, and compare what is presented in these reports from the department versus to what we have witnessed on the ground. So when these things are not happening, it is only then that we will speak out. But we have also witnessed that there are gene experts in many hospitals for TB screening and testing, and some of these machines were bought. Our government spent a lot of money, but we have seen these machines not being used. So we will be disappointed if, based on this TB recovery plan, we will continue to experience the same thing, because it will mean that our government has just wasted money by buying these machines and other technological interventions if we are not going to use them for the purpose.
Yeah. What do you suggest should be the approach that we take in creating the kind of a national strategy that is not just responsive to events, right? Otherwise, we'll always be having a recovery plan because we are responding to a particular event that is happening. But what should we be doing, or what kind of a strategy should we be creating that has long-term impact and the greatest impact, particularly in the fight against HIV and TB?
I think the first lesson that we need to draw as the country is the successes and achievements that we have attained as the country in our response to HIV. In that process, the people who were in the forefront were activists, were people who are working on the ground, like your health professionals and other intellectuals who were able to build the capacity at the community level. And then in that process, communities were able to be educated about HIV symptoms, prevention, and all that stuff, and the adequate treatment. And then in that process, activists were able to put pressure to government, one, to ensure that there is ARVs that are available in the country and no one is left out. People are educated. There were support groups. But with regards to TB, we don't see that happening. So it is against that reason we are saying, if government can bring civil society, if government can bring the business sector and all other role players around the table, so that we don't have too many platforms to try to intervene on our TB response. We've got one approach as the country that will benefit the communities, the business sector, as well as our government, and allow communities to take a lead on what affects them directly, instead of taking consultants from nowhere and bring them to community, because most of the times these consultants do not have the interest of the people at heart. For them, it's all about money. So we need to do away with this and allow communities to take charge on what affects them, and allow and build the capacity at community level, so that even if the grant is no longer there, we will know that communities are empowered in terms of TB prevention, as well as what steps must one take in order for them to access TB services. So that, and also we need to fix the broken public healthcare system of our country. At the present moment, our clinics are still small. At the present moment, we've got clinics that have old buildings. So we need to improve. We need to invest there, but also without adequate human resource on health, we won't achieve what we want to achieve, because money on its own won't address all the problems that we have on the ground. And all what we are saying, let's focus on investing at facility or at clinic level. Let's focus in building capacity at community level. Then by doing so, we will know that even if money is not there, communities will be able to continue doing education and awareness in our communities. But also, let's look at those people that are missing. How do we go back, trace them, and link them back to care? And when they are linked back to care, are conditions in those facilities favorable for people to say, I'm comfortable to access health services in this facility, where people are not stigmatized, where people are not discriminated? Because at the end of the day, we need to ask ourselves as the country, what makes our country to have high defaulter rate on HIV and TB? It is because of some of the challenges patients are experiencing in our healthcare facilities. But in the main, we hope that in this process, our government will engage with healthcare workers,
Right.
will engage with community healthcare workers, because on a number of occasions, the rights of the patients are violated whenever there is a dispute between the employer and the employee.
Right. Okay.
The ones who are on the receiving end are the patients, because even in March, when the contracts of the CHWs were not renewed, we have seen in a number of facilities services being disrupted because community health care workers and healthcare workers were angry at the decisions that were taken by the department.
Okay.
And communities have nothing to do with that. They went to facilities and there were no services that were provided. Who was on the receiving end? It was the community. So we hope that these challenges and problems that communities are experiencing on a daily basis on the ground will be resolved, so that all of us, we can work together in addressing the challenges that we are facing around TB, HIV, and COVID-19.
Anele, Yalwa, appreciate your time. Thanks for coming on, Secretary General of the Treatment Action Campaign there.